Hey, um, so I was actually going to do a stream based off of like the respiratory and digestive system for this next anatomy exam, but in the middle of me talking about it, like right after I finished respiratory, um, I was made known to all of the respiratory components of my system because a roach crawled across my foot. And I was crying, screaming, breathing, hyperventilating. It was pretty cool. I was going through a lot of gas transport, and let's just say I got to know what I needed to know about the respiratory system. Okay, so we haven't gotten to digestive system yet, so we're gonna continue talking about it from there. All I want to say though is that it literally was really unnecessary, and it didn't need to take that long for me to apprehend that roach. Um, I don't usually get bugs in my room, so this was a really big polarizing event. I'm pretty traumatized, sorry. And I still haven't fully recovered, but we're just gonna try to like distract ourselves by talking about the digestive system. So, okay, so the functions. So you got ingestion, propulsion, chemical and physical digestion, absorption, and elimination. You got the anatomy, which is the mouth that helps with ingestion and mastication, enzyme hydrolysis, and it makes the bolus. The esophagus propels the bolus via peristalsis. The stomach helps with churning, hydrolysis, storage, and chyme. And the small intestine helps with segmentation, hydrolysis, and is the primary place for absorption. The large intestine is the secondary place of absorption for water, ions, and vitamin K. And the storage of waste is for the rectum, and the expulsion of waste is for the anus. There are four classes of food. You got proteins, which are amino acid chains connected by peptide bonds. You have carbohydrates, which can be monosaccharides or disaccharides. You got nucleotides, which are ribose, phosphate group, and a nitrogenous base. And then you got lipids, which are three fatty acids connected to glycerol. Some things to know. Suffixes. ACE is an enzyme, OS is a sugar, OGen is a precursor or inactive form that needs to be activated. Okay? So we're going to talk about some detailed anatomy. The mouth helps with mastication and hydrolysis, which is chewing and chemical digestion, and this creates bolus, which is a ball of food. This food is sensed by chemoreceptors on the fungiform or whatever, fungiform. So the extrinsic muscles help elevate, depress, protrude, and retract, and the intrinsic muscles help thin, widen, shorten, lengthen. There's some enzymes and glands in your mouth. There's two of them that helped with, I think, lipid and starch, carbohydrate digestion. So amylase helps with starch digestion, and lipase helps with triglyceride digestion. So amylase is made by the parotid, submandibular, and sublingual glands, primarily the submandibular, and the lipase is made by the von Ebner's gland. The esophagus does not do any of the absorption or digestion. It only functions to move the bolus via peristalsis. The esophageal sphincter, which is up here, it's a true sphincter. It is a voluntary muscle that relaxes to let bolus through. And now the gastroesophageal sphincter is a fake sphincter. There's a hole in diaphragm that lets food through and prevents the stomach acid from entering the esophagus. The stomach helps with the bolus that is entering from the esophageal sphincter. It churns this bolus with gastric juice, and it then hydrolyzes this bolus. So it'll break both the protein and the lipid. So there's, I think, gastric lipase, and then pepsin. So pepsin will break those peptide bonds for the protein, and then the gastric juice will help with the lipids. So you got the surface epithelium of the stomach. There's viscous alkaline bicarbonate mucus that protects the stomach from the gastric juice. There's four types of cells. The mucous neck cells help secrete mucus at the neck of gastric glands. The parietal cells secrete hydrochloric acid, and this is the gastric juice that kills bacteria and activates pepsin and also denatures proteins. So again, mucus cells help protect the stomach, then the parietal cells help secrete like the digestive enzymes. You got the hydrogen potassium ATPase pump that helps with primary active transport and pumps hydrogen into the stomach. Then you have your bicarbonate chlorine antiporter, which helps pump HCO3 into blood and Cl out. This is seen in the respiratory system as well. The antiporter helps pump HCO3 and Cl in and out of the blood cells. These two help create the alkaline tide, which is the blood in the veins are usually more basic than the arterial blood because the parietal cells secrete HCl into the stomach lumen and the bicarbonate across the membrane. I'm not sure what that means, but all I know is that blood in the veins is more basic. Give me a second. Um, I guess because HCl is acidic and then bicarbonate is basic. So since HCl is in the stomach and bicarbonate is on the membrane, it the blood in the veins, which is on the outside, is more basic than the acidic blood inside the stomach. Okay, whatever. That's the secondary cells, or the second set of cells, which are parietal cells. The third type of cells are chief cells. These secrete pepsinogen and a small amount of lipase. This helps with, again, lipid and pepsin. And then enteroendocrine cells, they help secrete hormones. So gastrin will help stimulate the acid production and stomach motility. Histamine helps activate parietal cells. And again, the parietal cells help secrete the hydrochloric acid and pepsin. And then endorphins suppress your appetite. Serotonin helps with stomach contractions. And somatostatin inhibits stomach motility and secretion. So that will be like when you're full. Okay, so there's some accessory organs of the digestive system, which include the liver, gallbladder, duodenum, and pancreas. Some more in-depth anatomy. You got small intestine, which are folds of mucosa and submucosa with villi and microvilli, which are also have a brush border. It's called a brush border. So there's three parts of the small intestine. The duodenum is where most digestion occurs. It receives chyme, hydrochloric acid, bile, and enzymes. The jejunum is where most absorption occurs. And then the ileum is important for vitamin absorption. So it's like it goes like lots of digestion to all the way to little, and then where absorption starts. And then the pancreas, oh, sorry, no, I'm getting ahead of myself. The liver is where things metabolize. There's storage of nutrients, there's detoxification, bile production, and bile in this liver will help digest fat. So the path of blood in the liver, it goes in by the hepatic artery, which is oxygen rich, as well as the hepatic artery and portal vein. So oxygen rich blood comes in by hepatic artery, and then nutrient rich blood comes by portal vein. Bile goes through the hepatic duct, but the blood doesn't go through the hepatic duct. Why do you need to know about the hepatic duct? Because the hepatic artery, the portal vein, and the hepatic duct are the hepatic triad. That's what they're called. But only two of these have like they carry blood, because bile comes through hepatic duct. Then the all of this lead to the sinusoid capillary, then the central vein, then the hepatic vein. Now the path of bile, it is made in the liver, and again it goes through the hepatic duct, and then it goes to the gallbladder for storage. And then CCK will prompt the contraction of the gallbladder. This will release the bile. The bile will go then to the cystic duct, and then the common bile duct, then the duodenum, and then the ileum. And these are where bile salts and fat are absorbed. So the bile will end at the ileum. Okay, so the pancreas produces digestive enzymes for fats, carbs, and proteins. So you got exocrine and endocrine cells. Exocrine cells secrete bicarbonate, which neutralizes gastric acid. Again, it helps with protection. And then there's also amylase, lipase, and proteolytic properties like trypsin and chymotrypsin. So pancreas pretty much does everything except for, like, it helps with all the enzymes except for, I think, nucleotides, but I think it actually does I think it just does everything except for nucleotides, because trypsin and chymotrypsin helps digest proteins, amylase digest starch, lipase digest lipids. So yeah, those are exocrine cells because it secretes stuff. Then your endocrine cells, they are organized into islets, and these secrete hormones into the bloodstream. So there's alpha, beta, and delta cells. Alpha cells help secrete glucagon, which helps the breakdown of glycogen into glucose, and then beta cells help secrete insulin, which is the buildup of glucose into glucagon. Or glycogen, sorry. And then the delta cells help secrete somatostatin, which again we talked about. It inhibits glucagon and insulin secretion as well as stomach motility and secretion. So goes all the way back. Okay, so the large intestine. It is rich in microorganisms. It absorbs water and inorganic ions like sodium, and this creates the osmotic gradient. Too little absorption will release diarrhea or lead to diarrhea. Too much absorption will lead to constipation. So the path of water and ions in the large intestines, it goes first through the ileocecal valve, which is a junction of the ileum of the small intestine and the cecum of the large intestine. So basically SI and LI connection. So that's the ileocecal valve. Good name for that. Then the appendix in the cecum of the large intestine, then the descending colon, then the sigmoid colon, then the rectum, and then the anus. All right, so that's all of the detailed anatomy. Now we're going to talk about physiology. We're going to talk about first digestion, and then absorption, and then control of digestion. So for digestion, again, we're going to talk about four foods. So proteins are digested by the brush border peptidase, trypsin, and chymotrypsin, and they turn into amino acid. So proteins are going to be digested in the stomach because, again, the stomach has pepsin, and then also the small intestine, because the small intestine has trypsin, chymotrypsin, and brush border peptidase. And yeah. And then carbohydrates, they are also digested by brush border lipase. They are also digested by saliva and gastric amylase, right? So the amylase in the stomach and the not stomach, sorry. You have the sorry. I'm so sorry. So carbohydrates are digested by amylase in the mouth and in the small intestine, right? And then are turned into monosaccharides. Sorry. Nucleotides are digested by small intestine nucleosidase, so brush border nucleosidase, and are turned into phosphate sugar. Lipids are digested by bile and lipase. So in your mouth you have lipase, in your stomach you have lipase, in your small intestine you have bile and lipase. So yeah, you got a lot, like pretty much everywhere except for the esophagus and the large intestine. So again, the esophagus and the large intestine do not do any sort of digestion. And then yeah. Um Now we're gonna talk about absorption. So there's three that use active transport straight to the capillary, and then one using exocytosis, right? I guess first we're gonna talk about the three using the active transport to capillary. So the amino acids and simple sugars and the nucleotides, like the broken apart nucleotides, these all are these all are used by the a sodium cotransporter and also facilitated diffusion straight to the blood capillary, right? However, for lipids, these are like they move through diffusion. So they go to epithelium, they form a chylomicron, and are exocytosis through the lacteal vein to the blood capillaries. So there's no active transport. So this is the only different one than the other two. The other three, like the protein, carbs, nucleotides, they are facilitated diffusion and active transport. Whereas lipids is more like exocytosis and diffusion. Okay. Oh my gosh, I'm getting a cold. Um, okay, so two last things. We're going to talk about the control of digestion, and then we're going to talk about pathology. So digestion, how is it controlled? You got the cephalic phase, the gastric phase, and the intestinal phase. So the cephalic phase is the first phase of digestion. It activates the PNS, which is the parasympathetic nervous system, not the peripheral, the parasympathetic nervous system, and acetylcholine, which then causes salivation and the secretion of lipase, amylase, gastrin, hydrochloric acid, and stomach motility. So basically, the parasympathetic nervous system and acetylcholine will start all of the enzymes and whatever. Then you have the hormonal mechanism that kicks in. This will include the gastric phase and the intestinal phase. So the gastric phase starts by like the food activating the gastrin, hydrochloride, and pepsinogen secretion and churning, and then the intestinal phase lowers the motility. So chyme can go. It can be like two ways, I guess. So chyme can turn into fat, which okay, so chyme can turn to fat, which goes to CCK, and then lipase, and then after that, the motility will lower. And then chyme can also be digested by hydrochloric acid, releasing secretin, and then helps with bicarbonate release, which will then again lower motility, HCl, and pepsin. And then lastly, you have the neural mechanism, which is the enteric nervous system, gastrocolic reflex, which means the food will help the lower intestine move chyme, and the autonomic nervous system, which means the sympathetic nervous system lowers secretion motility, parasympathetic increases both. So like you have the two nervous system. So yeah, it's a little bit confusing, but I'll get it. Pathology. You have gastrointestinal or gastroesophageal reflux disease or disorder, which is basically heartburn. This is when gastric juice goes up your esophagus due to hiatal hernia and excessive eating or pregnancy. An ulcer is caused by Helicobacter pylori, which is 95% of gastric ulcers are caused by that. This can be due to chronic aspirin use. So the acid in the stomach, or like the acid in the small intestine, will cause a duodenal ulcer. Inflammation and stomach lining damage is caused by this. And this is, again, due to the increase of gastrin and acid. Cholera is caused by Vibrio cholerae. This produces a toxin that binds to the small intestine and prevents water and electrolyte absorption. This means a higher excretion, dehydration, and diarrhea. So there's less absorption, so there's more excretion. Jaundice is a yellowing of skin and eyes caused by a blockage of bile duct. Diabetes is too much glucose in the bloodstream. The treatment for this is dialysis. Type 1 would mean no insulin is made, and this is hereditary or congenital. And then type 2 is the insulin receptor is being desensitized even if there is insulin. So the dialysis will show if there is or isn't insulin. If there is insulin, that's type 2. If there isn't, then there's type 1. Okay, that's all I had to say. Goodbye. Hopefully the roach doesn't bother me again.